Hey everybody, Melissa Marie Harvey with MyoPro Institute. We're going to talk about tapotement today. So tapotement is not everybody's favorite because it's very physical. Usually it's a very excitable stroke, right? So it's quick and it can become sedative if you do it for long enough. They say like 15 minutes. After 15 minutes of tapotement, it becomes sedative. I don't know about you, but I can't do 15 minutes of tapotement after doing this for 25 years. So I utilize tapotement in chair massage and sports. So it's excitable, right? It's getting the patient ready for, or getting the athlete ready for an event. For chair, I usually do it at the end of chair massage. So it wakes the person up as I'm going to take them out of the chair, right? So it's not a stroke that we'd utilize normally in clinic for like a relaxation massage or anything like that. So, but I want to show it to you anyways. So I'm going to show you some tapotement over the sheet because normally as we do it, we're going to be over close when we're doing some of these, right? And tapotement is various forms. We have tapping, we have beating or pounding. We have slapping, we have hacking, right? And we have what I like to call the wet meat slap, which is also called diffused, if you really want to get technical, okay? Now, any of these strokes and cupping, I'm going to show you cupping at the end because that takes it right out of me. So we're going to save that for the last. Anytime we're doing tapotement, you want a loose wrist and loose fingers, right? So it's not that karate chop that you see everybody doing, right? It's not this. It is loose fingers as you're doing it, okay? So the various types, we have beating, which is done over bigger muscle bellies. So beating is good on the glutes, on the hamstrings, quads, right? We have hacking. So beating, again, my hands are closed. And I'm in my stance, and my stance is moving. I'm not doing this with my shoulders. I'm moving my body to move my hands. Okay? So it's hitting with the ulnar side of my hand. Fists are loosely closed. Then we have hacking. So your fingers are open up a little bit more. Mine tend to close a little bit because my palmar fascia is really tight. So it's going to kind of look like this for mine. But again, loose hands, loose fingers. And that's hacking. Again, popliteal space, endangerment site. We're going to jump over that. We're not going to do tapotement there, right? Hacking on the lower leg. And then on the foot, I'm going to do slapping. And then effleurage everything out. So if I were doing this as an ending stroke before they're getting off the table, I could start slapping, hacking, beating, hacking, slapping. Okay. Now, some of the other ones, we're going to need skin. What I didn't show you for petrissage was skin rolling. So let me show you that quick. So skin rolling is usually done on dry skin. We did put a little bit of oil on her, but I think we're going to be able to get through there. So skin rolling, I always think of my thumbs as a plow. I grew up in New York, so I think of a snow plow, right? My fingers are pulling the snow towards my plow. So I'm always keeping that fold of skin between my fingers. And where it becomes a little tighter is where they're having the adhesion. And you should be left with some good hyperemia after doing this. So again, usually this is done on dry skin. So it could be one of the first moves that you do if they like it. Normally, somebody's lower back gets a little tighter, gets more adhesed, so you might find that hard. But this can be done anywhere. It can be done over scapula. And remember, when we're working on the upper back, it doesn't matter if it's centripetal. It's all center mass. I can go any direction. I can go sideways, down, up. It doesn't matter, right? It's only on the extremities that I have to worry about going centripetal, right? So that was skin rolling. Some of the other tapotement that we can do, tapping. Done with our finger pads. And you can put a little oomph behind it when you're on the back. This can also be utilized on the face, almost like a really light tapping, almost like a raindrop, if you wanted to. Would feel really nice, okay? The diffused, or what I call the wet meat slap. My inside hand, I'm in my stance, inside hand is soft on the body. There should be a little bit of space in between your palm and her skin. The outside hand is the one that's going to be doing the move. This hand is just going to be moving like this. So diffused is good to use over an area that the patient might not be able to take regular tapotement over, right? And it's really nice to do over the scapula. All right. So the last one, and my least favorite, is the cupping. And let's talk about what cupping is. It's not the cups, it's not the clear plastic cups or the silicone cups that you see everybody wearing, or everybody's got the round marks on their bodies, right? Cupping is meant to be done over the lungs. It's meant to knock phlegm loose from the lungs so your patient can expel it. So it's very common when you're doing this that your patient has to cough up a loogie. So it's always good to have a waste paper basket next to the patient. We normally have what I call the feed bag effect on the pillowcase for our patients to have. If you are going to be doing cupping for the reason of getting the phlegm loose from your patient's lungs, I suggest doing a regular face rest cover and putting the garbage can right underneath the face rest. And then that way they can cough, spit, whatever they need to, right there into the waste paper basket. Now, I'm not doing this on everybody. This is only utilized on somebody that probably has a respiratory tract infection, has been on antibiotics, is towards the end, and wants to get rid of that last rattling stuff they got in the lungs, okay? So the premise behind it is our hands are cupped as if we're taking a drink, right? As you're cupping water, that's what we want. We want our stroke to have a hollow sound, not a slap, okay? And there's a specific way that we're going to do this. So again, our focus is right on the lungs. So I'm going to start in the middle, over the lungs, and then I'm going to move to one side and concentrate, and then I'm going to move to the middle, and then I'm going to move to the other side, and then I'm going to move to the middle, and I'm going to effleurage everything out after, okay? And it's fast. It's not comfortable to have it done. I would suggest if you are doing it over clothes, have the patient, if it's a female, unhook their bra. The reason behind that is if you do this over the bra, you're going to end up bruising their skin, okay? They're going to end up with bruises when they go home. So again, you're going to start out light and gradually get a little more oomph behind your stroke, okay? Are you ready? Oh, there we go. That worked. No, I'm just kidding. So again, that was Tapotement, guys. If you have any questions, shoot me a DM. You can also text me on my cell phone, area code 315-450-1852, and I can answer any questions that you guys have. Thanks for joining us. Aloha.